Okay, now therapists of different schools of therapy try to assist people with personality disorders to gain better awareness of their self-defeating behavior patterns and to learn more adaptive ways in relating to others. Despite the difficulties in working therapeutically with these clients, promising results are emerging from the use of relatively short-term psychodynamic therapy and cognitive behavioral treatment approaches. Now again, this is something that we often see with many of the different psychological disorders, is that one particular theory or perspective doesn't seem to be able to support many, or certainly not all, of the psychological disorders. Pairing and tripling, that is, the overlap of therapies, tends to have the most dramatic impact. So let's get on with this one and see what we can figure out about treatments. Psychodynamic, it's typically the more modern version of psychodynamic therapies are brief, but they're structured. About 40 weeks. Now, there are a variety of different therapies that can, in psychodynamic, be shorter and in some cases longer. Personality disorders are more challenging, but psychodynamic appears to have a particularly or more positive approach. It emphasizes interpersonal behavior, and it's more active and a bit more confrontational style. Now, because of the rigidness that people hold to certain things in personality disorder, sometimes confrontational approach can challenge them on what they believe, your sort of underlying belief systems, and sometimes pushing or confrontational style challenges that, and that's where some of the breakthroughs can be made. Behaviorally, well, they view things more, not so much in terms of personalities, but rather acquired maladaptive behaviors. That are maintained through, as you would imagine with behavioralists, positive reinforcement, or at least reinforcement, whether it be negative or positive. Therefore, replacing maladaptive with more adaptive behavior, well, using techniques like extinction, modeling, reinforcement techniques, these are really the direction of what behavioralists will take. Now, there's two groups that are showing some success in this particular model. One is Beck. Beck uses what, in Beck's model, helping to connect cognitive distortions. So the cognitive is thinking, distortions would be out of sync with perceptions of reality. So these thinking patterns that are distorted. So they're helping to correct the cognitive distortions, supporting either all the good or all the bad sense of oneself. And so by trying to correct that, you're trying to integrate that there's not the extremes of all this and all that, but there's a blend of the two. Now, Linehan has a dialectic behavior therapy, DPT, and it's a combination of behavior therapy and supportive psychotherapy. And so it utilizes learning strategies of maladaptive behavior to adaptive, but also the psychotherapy at looking at the unconscious beneath the surface and certainly the childhood experiences. Biological or the drug therapy, drugs don't seem to have the kind of long-term benefit that is desired for persons with personality disorder. Some promise has been found with Prozac and other similar drugs that target serotonin levels in the brain, but it's not by itself, drug therapy that is, the most desired strategy. It's done oftentimes in conjunction with behavioral or cognitive or even psychotherapy. Now, a Canadian perspective on treatments, well, there's a few. There's three in predominant that are most predominant, sorry. One is psychotherapy, and where they look at reducing extremes of maladaptive behavior patterns and bring out more of, bring to the patient's attention. There's an approach that's known as reality therapy, and essentially what it does is it doesn't imagine or it doesn't strategize around what might be or what could be, but talks about what in fact is. And so it brings attention to the here and now. Psychotherapy, in terms of the Canadian approach, is looking at bringing things to the attention of the person in the here and now, not imagining its adaptive ability or anything, just the behavior right here and now. Secondly is historical perspective of maladaptive behavior, where the patient sees the pattern over time. And so using diaries and using longer-term treatment strategies of meeting with somebody can keep in track of the patterns that start to emerge, and drawing that to the attention of the individual can start to see how they may be in more control of some of the outcomes that may be undesirable, or at least to try to integrate these extremes. And 3 would be skills to practice alternative and more adaptive behavior patterns. So you're actually practicing skill sets. Going into, you could be using role playing. You could be using group therapy where each is talking to another about strategies that have been used. So it's a different approach. It's not unique, but it is an approach that many more Canadians are using with personality disorder.